Well, I want to talk about experience during the pandemic, but I want to talk about it specifically in the context of power. So taking the power to change, and what have we learned from the pandemic? And when we think about, power, what does it mean? I like this definition here from Bertrand Russell, and he says, power is the ability to produce intended effects. And what I'd say as well is you probably, get to read a lot of stuff and hear a lot of talks around what we learned from the pandemic. But I think, or I hope, that this will be a talk about what we learned from the pandemic that is like no other talk that you will hear. And again, just a quote, we don't see things as they are, we see things as we are. And so, this is my take on some of the things that we've learned about how to make change happen as a result of the pandemic. But I wanted to start with a health warning. And, we talk all the time about the pandemic as if it's like the only thing that's happened or the biggest thing that's ever happened. Because actually, when you think about health and care improvement, I think we have to take a bigger perspective. And of course, when we look at the last 12 months, many of the methods for delivering health and care that we took for granted before the pandemic as the norm have kind of been swept away as people have responded to COVID-19 in the most extraordinary ways. Yet, looking at that big picture, what we can also see actually over 30 plus years is that the speed and complexity of change has been increasing all that time. So when we look at many of the extraordinary, innovative things that have happened in response to COVID-19, I'd say that actually a lot of what's happened as a result of the pandemic is amplifying things that were happening anyway. So I want to frame my talk in the sense that this isn't about a pre-COVID world or a post-COVID world. It's about a world that we live in, a world of health and care that was already moving very fast, moved a heck of a lot quicker as a result of COVID-19, and will continue to work at speed. So, when we think about the future that we want, the future that we want to create, based on our learning from the pandemic, actually, it's about the more we can mobilize people around the potential for a radically different future, the better we're going to be prepared for it. And when I think back to much earlier in my career, when I was a kind of trainee healthcare improvement leader, this quote comes from Michael Hammer, 1993. The secret of success is not to foresee the future. It's to build a system that is able to prosper in any of the unforeseeable futures. So, I just wanted to say that at the beginning. So absolutely learning from the pandemic, but we have to see it in the context of a much wider change. So, when I look at the world, there's certain frameworks that I always use for thinking about change. And one person whose counsel I take often is Kurt Lewin, and he says, if you want to understand the world, try to change it. And if you want to understand the world, try to change it during a pandemic, because actually you understand it even more. A second framework that I'll come back to this in a minute, that I use often is thinking about power. And I think it's very helpful to think about different kinds of power. And again, I want to talk about what's been happening in the pandemic in the context of this. And we can contrast a kind of power that we call old power. This is it's like money, it's like a currency. Some people have got a lot, but most of us haven't. And this kind of power is held by a few people in organizations, and it gets pushed down in organizations and systems. And we can command people to do things in old power ways. You've got to do that because it is the policy, or you've got to do that because it is the standard operating procedure. Okay, you've got to do that because it's the rule. And old power is largely closed. So if I'm the leader of a hospital system and I'm working with leaders in the local community, I can't command them to do anything because my power ends at the door. And old power is largely transactional. And it's about structures and processes and systems. It's about holding people to account. It's about governance mechanisms. Okay, let's contrast that with new power. New power is like a current. It's like a source of energy, and it's made by many people coming together with a common cause. And the more people that engage in my change that's set up in new power ways, then the more power I have, and we can pull it into our organizations and systems, and it's shared, it's open. And new power is based on relationships. One of the big differences between old power and new power is that if I engage in a new power way, I do so willingly because I want to, not because I have to. Whereas in old power ways, it's about me in the system. So, what I want to talk about in this presentation today is what's been happening with regard to power and levers for power in the system as a result of COVID, and where might things go. So, before we kind of carry on with that conversation, I thought what I should maybe do is to think about some contrasts, okay, between the UK and Canada, because in a sense I'm telling my COVID story, but what's yours and what's your context? So let's go back. So let's first of all talk about the UK and Canada. So do you know, geographically, you can fit the UK into Canada 41 times. So if you can see this map on the left, you've got the little United Kingdom, and then you've got a very big Canada. And what we can also see is that the population of Canada is 37.7 million, and the population of the UK is 63.18. I think this is really interesting in the context of our COVID experience. So, you've got 41 UKs size in Canada, and yet in the UK you've got a population that is about 1.7 times bigger. Okay, and let's think about this in our in terms of COVID. So again, I thought it'd be interesting to do some comparisons. So what we're seeing here on the left is a comparison in terms of COVID cases, and this is showing confirmed COVID-19 cases per million people. And we're looking, over time. So what's interesting, the first wave of COVID, okay, there's hardly any differences between the UK and Canada. But when we get to kind of September onwards, if you see the red line, which is the UK, blue, and the black line, which is Canada, you start to see some really big differences. And overall, to date, and this is the latest data that I could get actually earlier today, there have been 863,500 COVID cases in Canada, whereas in the UK there's been 4.17 million cases. And again, really big differences when we look at deaths. And again, this chart on the right is talking about deaths per million people. So what we're seeing here again is very, very big variance in terms of the number of deaths. And what you're seeing in the UK is a country which has got 1.7 times the population, but 5 times the deaths. And I think that what's happened in both of our countries has been terrible and tragic, and certainly in terms of the role that I do, as an improvement leader, I've felt very proud to be part of that response. But living with very, very difficult situations every day, colleagues who have died, friends who have died, really difficult, really difficult situation. So let's talk about this in the context of power. and what's happening. I think it's interesting to think about the metaphors that we're using around COVID, and you know, the dominant metaphors, if you like, have been old power metaphors. Okay, you know, the war against COVID, the fight, the battle, lots of criminally orientated metaphors. You know, we talk about lockdown, curfew. On social media, we talk about COVIDiots and transgressors. And we frame our doctors and nurses as superheroes, you know, troops in battle. We talk about the front line. We talk about battling down, you know, getting a grip. And again, very much old power metaphors around command and control, top-down leadership. I think what we're starting to see more and more are new power metaphors around COVID. So, you know, the idea of a journey with challenges and a hopeful destination. We're thinking about human actions that are positive, that are based on shared purpose, you know, building, forging, reconstructing, creating many people working together, each person you know, playing their part, whoever they are in the system or the hierarchy. This idea of interdependence, you know, I've got my role to play, but I'm dependent on others. And, you know, this sense of creating resilient, connected communities. And, you know, very much seeing both kinds of metaphors, but I think increasingly, you know, moving towards a new power way of thinking. Okay, the very big shift I think that we're seeing in change thinking is around this idea of structure and agency. So so I'm a social scientist, and you know, when you go to social science school, one of the first things that you learn is this model, which is about the relationship and the tension between structure and agency. So, you know, how do you change the world? And you know, a very prevalent way of thinking is around structure, and structure isn't just about actual you know, technical structures. It's about a wide group of things where, in a sense, you use levers and nudges to make change happen. So structures and systems, performance goals, compliance, regulation, assurance policies, you know, building in incentive systems. Okay, agency is about helping people to create the power to do it for themselves. So agency is about activation, ability to make choices, and people taking collective action, you know, creating leaders everywhere, social action, social solidarity, social movements. One of the things I think that we're seeing really strongly is, you know, if we look at public policy, what we've seen is that in recent years, the last couple of decades, the predominant approach for making change happen has been structure. But what we've seen as a result of COVID and a much stronger risk appetite and the need to just get on and do things, is this big shift towards agency. And I think, you know, we're in a system that needs both, but I think we're seeing this very clearly. And you know, when we talk about agency, okay, agency means the power individually and collectively to make a positive difference. And a really good COVID example of this is in Jönköping in Sweden. The role that's been played by the Living Library. And, you know, you think about a library, it's a place where you borrow books to gain knowledge. Well, a living library is the same, except it's real people with lived experience. And if we want to make change happen, we, you know, people from the Living Library come and contribute and support co-production. And what you've seen in Jönköping is the way in which people from the Living Library have become the most incredible digital coaches, and they've supported thousands of people that use services to make the switch to virtual consultation. Have been playing a really big role in that. And you know, people say, well, you know, I'm in a really ingrained old power system and I can't make things happen. I haven't got agency. But actually, you know, what the research shows is actually something quite different. So I took this from Leandro Herrero, who writes about viral change. And he says, you know, people who are highly connected have got twice as much power to influence change as people with hierarchical power. And what I'd say, you know, is now is the time for people, you know, working with agency in new power ways to come to the fore. And again, you know, thinking about this, that in many ways, what COVID has done, you know, the COVID experience has speeded up what was happening anyway. One thing that we know about is that in most organizations and systems, there are a very small number of people who are highly influential. And this comes from Innovisor, which is a Danish company that does organizational network analysis. And what they've done is they've literally gone into hundreds of organizations in public, private, not-for-profit sector. And they always see the same kind of phenomenon, which is that typically in organizations, there's about 3% of the people who influence 85% of the other people. Okay, and so, you know, the people that are actually driving the change are this very small number of people. And, you know, we call them super connectors, the 3%. Okay, why are they important? Because actually, if you look at why change fails in many organizations and systems, okay, typically it's because people in the old power system, people with the formal authority, aren't very good often at being in dialogue with the informal system. Okay, and the people that lead the informal system are these super connectors, you know, and they're the people that have got the relationships, the networks. They know the content of the organization, they know the context. And what they're doing is they're driving perceptions of other people. So, you know, if people are uncertain or there's change afoot, other people will go to these super connectors for advice. And what these people do, these informal leaders, they make sense of things and they reduce ambiguity for other people. Typically, these 3% leaders are trusted by their peers far more than formal leaders are trusted. And typically, they are unknown to formal leaders who don't actually invest a lot of time in the informal system. And at times of ambiguity and uncertainty, like a pandemic, okay, the role that these people play is even more important. This is also true for social media. Again, what the data shows us is that in health and healthcare globally, when we look at the content that gets retweeted, 85% of it comes from just 3.3% of people that tweet. So again, almost the same ratio. And, you know, we're seeing this, you know, the power of social influence so strongly during the pandemic. A couple of things here. On the left is a tweet from an oncologist who says, I actually think that Twitter is probably the best source of medical information right now for me as an active oncologist. On the right is a project that I've been involved in as part of the COVID response. And this was when we were wanting to scale up COVID testing massively. So we had a crowdsourcing platform looking for novel solutions to scaling COVID testing. And so we had a crowdsourcing platform. We wanted all kinds of people from industry, from academia, from inside the health system to put their ideas across. And about 20% of the people that contributed really good ideas that actually made a difference in our system came directly from social media. And again, you know, these super connectors, these people that are leading influencers, again, have become even more important. So just some examples here. On the left is Dave Morgan. He is a paramedic at North East Ambulance Service, and he's probably one of the most influential people in the whole of the ambulance service. Everybody knows him, everybody takes his guidance, hangs on to his every word, and he's a paramedic. In the middle, we have Trish Greenhalgh. She is a family physician and a professor of general practice at Oxford University. She's probably done more than anybody else in the UK around supporting and encouraging and leading a mask-wearing culture. And what we've got there is a photo of Ed Davey, and he was newly appointed as the national leader of the Liberal Democratic Party, and he went off to a community cafe to help to serve. And he only wore a shield and not a mask. And basically, Trish Greenhalgh was saying, you know, if you go to a cafe and your server is wearing this, they're actually increasing your chance of catching COVID. So tell them they need to wear a proper mask. And then on the right-hand side is Rachel Clark at Dr. Oxford, and Rachel's a palliative care doctor, like so influential. And any campaign or any principle that Rachel gets behind, you know, 100,000 people will get behind it as well. And you know, so none of these people are the formal leaders of the system, and yet they're huge leaders when it comes to influence, and that is, for all three of them, I think, has been significantly magnified during COVID. So, you know, we're talking about super connectors. How do you find them? Well, you can bring in a company like Innovisor and they'll do some analysis for you, or you can just go around and ask other people. And, you know, you just say, where do you go to for advice when you've got concerns at work? Whose advice do you trust and respect? And I think it takes about 10 people to find out. So what does that mean for me? Well, you know, you can be a super connector. Okay, and how do you become one? Well, you do it by being connected. You build your connections and relationships. Most of it is how you behave, because, you know, we've been talking already in the forum about trust. Okay, you know, being a super connector is built on being a model of trust and positive behaviors. And the one thing you always have to do to stay a super connector is always follow up, because if you say you're going to do things and then you don't, people will never trust you the next time. Okay, most of us can't be super connectors, but we can work with our super connectors in change. We can get their insights. Whenever there's change happening, we can involve them and engage with them. And the other thing about working with super connectors, it's a relationship. So what you can't do with these people is like work on one project, make them your best friend, and then when that project ends, start ghosting them. You know, it's a long-term relationship. And, you know, as senior leaders, we may actually be a lot less influential than we think, because, you know that if you want to get the same level of influence through, in old power ways, through top-down cascades of change, you need 4 times more people than to make happen what the 3% of super connectors can do. So let's kind of carry on with this, okay? I want to show you some data now that isn't published, but I just think is so interesting. This comes from Nicola Burgess of Warwick Business School, and she's recently been evaluating a partnership between the National Health Service of England and the Virginia Mason Institute of the USA. And the Virginia Mason Institute, which is like an amazing teacher of lean methodologies, okay, in healthcare. Virginia Mason were brought into the NHS to work with 5 hospital systems, okay, to accelerate their development in terms of being able to use lean methodology. All 5 hospitals got exactly the same resources. So they all got supported by Virginia Mason Institute. They all were in the same learning sets. You know, they all followed you know, the same methodology. Everybody got the same resource and did the same. And yet, when you look at the outcomes, okay, they were very, very different between the 5 organizations. And what Nicola Burgess and her team found, they went to look at the difference, and they basically found the only significant difference between these 5 organizations was the level of social connections between those working to lead improvement. So that's why I say here, you know, the idea of connection, relationship, building community is more important in spreading change than any other factor. And I just quickly want to show you two of those hospitals. Okay, this is Hospital A, and in performance terms, Hospital A is outstanding, and the Virginia Mason experience in terms of led to really significant performance improvements. Okay, what's happening here? What you can see in Hospital A is it's got a distributed network, and it's got a very high level of connectivity. Lots of interaction between different bits of the organization. Everyone's talking to each other. Dense clusters and grouping people together, high degree of collaboration. And this degree of connectedness is associated with a high capacity for knowledge exchange and learning. Okay, remember what that pattern looks like. Let's look at Hospital D. Hospital D has gone into special measures, which means the NHS nationally is giving it some special support to get better. Okay, but when a hospital goes into special measures, it's really grave performance challenges. Okay, look at the difference in shape. So I'll just go back to Hospital A again. Connected, clustered. Here's Hospital D. Okay, 2/3 of it is decentralized with chain-like structures. Okay, some bits of it are talking to each other, but most of it isn't. 1/3 of the network is disconnected with with isolated components, and this low to moderate connectivity shows a low to moderate degree of interaction, engagement, and knowledge sharing. So in a sense, what this organization got was world-class support from Virginia Mason Institute. And yet, if you haven't got the relationships and the connections happening, it isn't going to work. So, this is about how do we build agency. Okay, agency is about connection, it's about relationship, it's about the power to make a difference. And I just really quickly wanted to take you through 10 ways that we can do that. Okay, number one, create small changes one step at a time. We constantly underestimate the power of small changes. A small change that makes a difference to 1 or 2 patients is actually stepping over a line from being a concept or an idea to being a tangible thing that we've done, and creates a sense of hope and possibility. Number 2, emphasize progress, show that we're making a difference. Number 3, reframe your thinking so that, failed attempts become learning opportunities. Uncertainty becomes curiosity. Sometimes when we're a manager or a leader, we can't be uncertain when people, come to us with ideas, or questions. So we've got to flip it and say, well, I don't quite know, but that's a really interesting idea, and let's solve this together. Number 4, find your crew. A group unified by a provocative idea. Who are the people that want to do the same things you want to do? Number 5, get social support. The number 1 rule of agency and being a great change agent is you can't be one on your own. Number 6, make change routine rather than exceptional activity. That's why I'm such a big fan of organizations that really invest in quality improvement methodology, because every day we're making change part of what we do. Number 7, learn from the best. When we're working in social ways now, we can link up with anybody all over the world. So if we're trying to do something, who are the very best people in the world that we can learn from, and reach out to them on social media? The worst thing that could happen is they could say no, and often they don't. They'll say yes. Number 8, think story, because when we tell stories, people connect with us at a level of values and emotions, and are far more likely to engage with us in change. Number 9, build a spectrum of allies. Very often when we're passionate about change, we end up being in like a little echo chamber with people that think the same as us. And what we've got to do is find other people who might not support what we do at the moment, but could support it, and get a wider group of people. Find out what are the things that unite us, build a sense of shared purpose. And number 10 comes from Gandhi: persist. First they ignore you, then they laugh at you, then they fight you, and then you win. So what are my conclusions? Well, the leaders who'll succeed in the future will be those who develop the ability to operate in new power ways. And if COVID shows us anything about leadership, it shows us that. Of course, we need old power, and we need to be able to operate effectively in old power ways because we're still in an old power system. But we need to be developing new power approaches to leadership. Okay, we need to be building agency in new power ways. We need information flows through connections and relationships. We need to be designing change that takes account of the role of connections and relationships, and we need to be building individual capacity. And finally, I wanted to end with this quote. This is one of my favourite plays in the whole world. It's called Pride by Stephen Beresford, and this comes from a speech by a character, Joe, and it's actually written about the Yorkshire miners' strike in 1984. But I just think it's perfect for our current era. Whether we march with banners or without, the important thing is that we march together, all of us. That's what this thing has been about from the beginning. And that is absolutely how it's going to end, together, us united. And, wherever we are in the world, this thing is going to end because we come together with shared purpose and we support each other. And I'll end there.
Helen, thank you. Always very powerful and always very moving and thoughtful. And so still recognizing that it is late for you in Coventry and it's still after 11. We do have a couple questions, but I wanted to pick something up with a quote that started very early on that we, from Agnes Binigwaho earlier this morning as well. But what was quoted from Michael Hammer is, the secret of success is not to foresee the future. It is to build a system that is able to prosper in any of the unforeseeable futures. And that was very clear from her design in Rwanda around a system built on equity. That was able to then pivot under COVID and really shift to be able to move with it. So that's very poignant. I just want to ask a question about power, because when in BC as well, as we've been learning from many, we had been shifting to a new power way of one built on agency. So when the pandemic hit in the UK, I'm sure there was a shift to old power because of the need to move to emergency operations or others.
Yeah.
And I'm curious as to how things are transitioning back to the ways that had started in the new power ways, and are there lessons learned in that transition back to new power that had been on that path to start with?
Yeah. Thanks, Devon. So I think all the way through our whole experience of the last 12 months. Like you see both, and both are necessary and often in tension with each other. So there's been much need for moving very quickly in a commanding way. Whether it was our clinical response to the pandemic, or the operational deployment and delivery of vaccines at scale. It's absolutely needed. But many people think, you've got to work in an old power way in an emergency. But the reality is that that new power ways of thinking are equally important. And I think what we're seeing is people working in profound ways as teams as never before. You look at the role that the orderly or the cleaner plays at the heart of the team, the way in which that is being recognised, as never before. You think about communities and the resilience of communities and community responses. You even think about things like the fact that many of us are working from home and have gone into virtual working. And actually, when we're working virtually, we haven't got the opportunities to connect. We haven't got the nuances of understanding body language and behaviours. And I think it's it's so much harder. So in a sense, our need to work even harder in new power ways and engage and create a profound sense of belonging in teams that are virtual, I think is really important. So I think we're seeing both, but I think what we mustn't let happen, okay, is that lots of things change very quickly and had to. So we developed a much stronger risk appetite of doing things in different ways with less rules. And in a sense, what we mustn't do is, as we move more and more into recovery now, is to kind of go back to the old way. Because in a sense, we've let the genie out of the bottle now, and we've got to keep working in these new ways.
Very true. Very true.
Thanks, Helen. We have a question actually from one of our physicians here in BC, Chris Rauscher, who's just, I think, again, reflecting on the issue of equity that was raised this morning, and how do we support our vulnerable populations? And the question is, how can agency best support that, but recognizing that, well, we all may have agency, there's different levels for those who are disenfranchised. So how do we actually create systems that can support that?
Yeah. So when we talk about agency, we do so understanding that we have very unequal starting points in terms of power and privilege. So what I'd say is we have to start from where people are, and we have to understand what really matters to people, and what their needs are, and what needs doing from their perspectives. I think it's really important. And like, the word I hate the most, okay, is empowerment. I mean, I think we should ban it, because it's like the idea, we want to empower our vulnerable communities, or we want to empower our frontline staff. You can't empower people, because well, you can, but it's not a very good idea, because like, if I'm a senior leader and in an old power way, and I empower my frontline staff, or I empower a particular community, it's like in an old power system, and I can take the old power back. So I don't think it's about giving power to people. I think it's about helping and supporting people to build their own agency, and whether we're talking about disempowered populations, or we're talking about frontline staff. Okay, people building their own agency and supporting people to do that, I think, is how we want to think about it, not ceding power or empowering people.
Thank you. Last night at Health Talks, we heard from two students who won the competition for presentation, and came to Health Talks to present, speaking about how to transmit information through various forms, memes, for example, in a way to the younger demographic, to be able to capture their interest, or be able to produce information, versus, say, what comes from public health memos or from health authorities or otherwise. So we had a question from one in the audience saying that private companies often try to actively attract influencers or super connectors. So in your experience in thinking of healthcare leadership, is there a role for healthcare leadership or organizations to consider influencers or super connectors?
Interesting, isn't it? I think some of the principles are the same, in a sense that an Instagram super influencer, will be able to influence the buying habits of other people, and maybe we should use the same principles. So first of all, actually, if we want to make change happen, let's understand who our super influencers or our super connectors are, because we know that that these people can make or break change, and so just finding out who they are and understand the role that they play in change, and you know, bringing them in to be part of things, I think can make a you know, can make a massive difference. So it's a different context, because in a sense, an Instagram super connector, you know, you'd you know, work with those people to, you know, get other people to buy things. Whereas our super connectors, it's about you know, working with them in a way that enables us to influence, you know, lots of people to make change happen. And I think, you know, if we are going to influence our own super connectors, we can't do it in a manipulative way. We can only do it in a good way, with an authentic heart, because you know, those, you know, the people that are our super connectors won't want to engage if we're not trying to make positive change happen. So I think, you know, there's some parallels in terms of the principles, but I think our you know, our purpose is more authentic.
Trust. Yeah, absolutely.
Yeah.
Trust. Yeah.
I love that. Find the super connectors and then tell them what to do. See how well that works.
Yeah.
Helen, there was another question about, you know, this idea of solidarity and standing together and united, but how do you at the same time be open to and accommodate dissent, new ideas, and avoid slipping into groupthink when you have that shared purpose?
Yeah. So, you know, I think you know, when we think about shared purpose, the thing about shared purpose is that we have to focus on the things that unite us, and it's got to be connected to purpose. And so, you know, very often, you know, when I'm working with a change community, you know, we're talking about people with very different levels of power and privilege, and we're talking about people with very different views, but actually all those people have got a contribution to make to change. So I think, you know, we have to spend time understanding, you know, what are the things that unite us. And I think one of the best ways of doing that is through story. So actually, you know, spending the time you know, listening to each other's stories, and understanding stories, and you know, valuing difference. So, you know, very often we talk about you know, how important it is to build a sense of belonging, and being inclusive, and of course we want that. But if we don't actually start from the absolute unique things that each person brings, then it's just assimilation. You know, people have to fit into the existing way of doing things. And true belonging is where we create a sense of belonging and inclusivity, but we appreciate the unique things that each person brings. And the only way that we can do that is if actually we take the time and effort to find out about each other, to hear each other's stories, and understand the things that each person you know, that each person brings. So it's about, again, working in that highly relational way. And going back to that data I showed you, you know, hospital A and hospital D, you know, I can tell you now that hospital A actually invested a lot of time and effort in building relationships, in connecting, in hearing each other's stories, in building highly trusting relationships with each other, whereas that hadn't happened in hospital D.
Yeah. Well, yeah, and just thank you for that, Helen. And I'm realizing it's approaching midnight for you. And so I just want to say thank you so much for being here. I know you know, you have a special place here in BC and with us, and just thrilled that it worked out this year to have you join us. And I know that our paths will continue to cross in the future, and I imagine we'll have you back in person, we hope, at some time. So thank you again for joining us today.